I'm Dr. Anthony Kaveh, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist. And I'm live today because several patients and fellow doctors have asked me about the recent tragic case about Maya Kowalski that involves ketamine therapy and what might involve death from medical gaslighting. To be clear, I am not involved in this case and I don't have any more information. I'm not privy to anything beyond what's in news reports, but the patterns that I am observing that are coming out of these reports is so concerning for what many of my patients have experienced in their course, struggling with chronic pain, PTSD, especially medical PTSD, or anxiety and depression. And that's why I want to share what this case is raising awareness of that affects so many of you and your loved ones, perhaps without you knowing. So I'm going to go through the definitions of what gaslighting is, what CRPS is, ketamine, etc. But first, the case that you need to know the basics about. As tragic as it is, there are things we can all learn from it. In brief, Maya Kowalski, at a very young age, was diagnosed with complex regional pain syndrome. I'll explain that in just a moment. There are no good treatments for CRPS. We'll discuss some of those, but ketamine therapy was sought out by Maya's parents, and it was actually an unusual form of ketamine therapy, but one that did bring Maya pain relief subjectively. I'll explain what that therapy looked like as well. She did find pain relief, but had flare-ups, which is not uncommon in CRPS, especially in the patients that I treat. But one flare-up in particular led her in the hospital. Now, when she was in the hospital, Maya's mother, Beata, who was also a nurse, advocated for Maya to receive ketamine treatment for her pain flare-up. However, because ketamine was used in an unusual way, not necessarily wrong, though not the way that I use it in my ketamine clinic, I assure you, there was concern that Maya's mother was pushing for a potentially abusive type of treatment for her daughter. This led to a cascade of events that is under heavy scrutiny right now that ultimately led to separation of Maya from Maya's parents in isolation in the hospital out of fear of child abuse, or what's called Munchausen's by proxy. We'll discuss that. And during this time of isolation, in this time of isolation, Beata, Maya's mother, unfortunately took her life. And there's so much that still needs to be explored in this, and both sides of this case, both the hospital and Maya's family, have significant opposing views. So I'm not going to try to explain any more about what I believe is right or wrong, except the pattern that I see in many of my patients that I want you to be aware of so you can advocate for yourself to hopefully prevent such hardships from happening in yourself and loved ones. First off, what is gaslighting? Gaslighting is defined as what others say or do that is intended to raise fears, uncertainties, or doubts in the minds of someone else. It's also called questioning one's insanity based on what others say. Sorry, questioning one's sanity, not insanity, based on what others say. So gaslighting is intended to make somebody ultimately doubt themselves. And this is so toxic, especially in any trusting relationship with parents, with therapists, or with doctors, people that we trust. CRPS, as I mentioned, complex regional pain syndrome, is this mysterious yet very debilitating and catastrophic condition that appears to happen when nerves are not speaking to each other properly. So, for example, what should be interpreted as light touch is interpreted as a stabbing knife, for example. We don't know the causes. In some cases of CRPS, it arises after tissue injury. And after those tissues and nerves are injured, the nerves regrow but don't grow and connect together properly, leading to that terrible misinterpretation of information from that nerve stimulation to the spinal cord and the brain. In some cases, We don't know where it comes from. In some cases, there's a heavy relationship with our mind-body health. Things like untreated PTSD or undertreated anxiety or depression can absolutely interact with the severity of CRPS or how it heals. It's not to say that it's all in your head, but what is in your head absolutely does affect how the rest of your body functions. There's no question about that mind-body connection. And then there is conversion disorder. This is what Maya was accused or was suspected to have during her hospital stay. Conversion disorder is when there is a neurological condition or deficit that we don't have an organic answer for. For example, someone who has stroke-like symptoms, but there's no evidence of stroke on any head imaging, on MRI or CT scan. Or somebody who might have memory problems, but there's no reason to understand why they have that problem. We say that they have a conversion disorder if every test is negative. We believe it's from the mind interacting so heavily with the body that it literally paralyzes our body and we can't control it. You can see how this can very easily be conflated with gaslighting. And lastly, ketamine. Ketamine is a powerful anesthetic that I use here in the operating room and I use in my ketamine therapy clinic in San Francisco. It was originally used as a medication that puts people to sleep for surgery, but it also has powerful effects at lower doses that can help alleviate pain and have significant impacts on our ability to come out of feelings of being stuck, whether that's being stuck from depression, anxiety, some elements of PTSD or chronic pain or even addiction to an extent. There is still a lot of data that needs to be gathered, but a lot of powerful evidence as well. We'll talk about that at the end and why Maya's mother was taking Maya to Mexico and Maya's father for these treatments. Ultimately, they were putting her in a ketamine coma for her CRPS pain. So this was new for the doctors that were treating Maya in the hospital. So new, in fact, that they thought that these high doses of ketamine, higher than, like I said, the low doses that we traditionally use for ketamine therapy for these purposes, these doses were so high that they actually involved putting Maya, from my understanding, to sleep with her needing to be intubated with a breathing tube like this for extended periods of time to literally quiet the nervous system to allow the CRPS to be at ease for a couple of weeks or months thereafter. So that was the type of pain relief she was experiencing. That might not sound like a long time to you or me, but I assure you, when a patient is having unrelenting pain, even a couple of months of pain relief can be huge. Now, the frequency at which they were repeating the ketamine comas with breathing tubes and ventilators like the one behind me, I don't know, and I don't think we have that information publicly. But suffice to say that when Maya came to the hospital, the doctors were like, we're not doing this. That's what it appears like, from my understanding. And they actually questioned Beata, Maya's mother, and saying, well, you took your daughter to Mexico to have these treatments, or anywhere else. I believe it's Mexico. There's still a lot of data that we don't have publicly available. And they did not want to do this to Maya. They did not know if Maya had CRPS officially diagnosed. There was some questioning to the point that they thought that maybe it was conversion disorder, that perhaps Maya was in some ways thinking she had pain or faking her pain because they could not physically prove her pain. They did some experiments like putting her in a room, putting the commode where she would use the bathroom far enough away that she would have to walk to see could she walk to the commode to prove or disprove how much pain she was in, whether she could walk to it or not. You can imagine that this could be so embarrassing if you're being video recorded and if you can't walk to the commode and you soil your pants, which is what seems to have happened. Now, the problem, I mean, there's so many problems. And by the way, I see all of your questions. Please keep your questions till the end. I want to get through the basics and we will do our live Q&A once everyone's had a chance to digest this really complex story. But The conversion disorder affects Maya clearly as a child when you're told that this is all in your head. And then there's this gaslighting of Beata, Maya's mother, thinking that everything you have done for your daughter to protect her, to help relieve her suffering. You are also a medical professional, you're a nurse. You made an informed decision to put your daughter through this ketamine therapy that has provided some pain relief at least. Then you're told that actually you're being abusive to your daughter. We are so concerned that you have been abusive to your daughter that we're going to actually put your daughter under what's called a hospital protection. We're going to separate you so you cannot even see your daughter because we're afraid that you're abusing her. So this is now instilling fears, uncertainties, and doubts in Beata, who is trying to do the best for her daughter, as far as we know. And then Maya, who's told that her pain may only be fabricated or all in her head, questioning her understanding of her body, which as a child, to the developing brain, is one of the hallmarks of the beginnings of PTSD, when we no longer trust our gut instincts. Something as primal as, are we in pain or not? All mammals and reptiles and every living creature has to respond to pain to survive. And when that instinct is questioned, you can imagine the amount of trauma that it might set someone up for the duration of their life thereafter. Which is why gaslighting can be so detrimental when it involves the very core of our identity, pain, and our mental well-being. This is a lot of information, and I appreciate your questions. Like I said, we will answer them at the end, as many as we can fit in. What I want everyone to take away is that when our powerful gut instincts are ignored repeatedly, it is similar to what we see in patients with PTSD who are so disconnected from themselves because they try to disassociate from the pain and agony that they're reliving through past traumas, whether combat trauma, whether trauma in an operating room, when my patients, not my patients, but other patients have had maybe awareness under anesthesia, maybe childhood adverse experiences, whatever that past trauma, when we try to disassociate from that trauma, we also disassociate from our gut instincts, our intuition, our authenticity and genuine selves. That disassociation erodes our ability to trust and work with doctors or with parents or with therapists because there is a power differential. And if you can't trust people that have hurt you before, that can add fuel to the fire of feeling stuck. The perseveration and rumination that affects so many of my patients that come to me for a evidence-based ketamine healing experience, different than what Maya went through to an extent, based on the information we have, but also puts patients in a chronic survival mode. And when you are stuck in survival mode, that stress without the support of loved ones or therapists or doctors unfortunately sets up the scene for the end case, which appears to have affected Beata in the form of suicide. Once again, I'm not saying that we know exactly why Beata committed suicide. This is the topic of this ongoing lengthy trial. But my patients have similar challenges, and just to summarize, gaslighting, leading to fears, uncertainties, and doubts, which compound with past traumas, that lead us to ignore our gut instincts, lead us to feel increasingly stuck in hopelessness cycles, in survival mode, and without survival mode being accompanied by trust and compassion. That survival mode can lead to the end case. You have asked so many good questions, and I promise we'll get to as many as we can at the end. I just want to end by explaining what ketamine is and why ketamine is at the center of this trial, because ketamine can have powerful anti-pain effects, but it depends on the dose. It depends on the doctors administering it, depends on the mindset that the patient has prior to the ketamine therapy, and it depends on the environment that the ketamine is delivered in. CRPS ketamine protocols are significantly different than the ketamine protocols used for anxiety or depression based on what's available in the literature. There are about 3 randomized trials looking at ketamine for CRPS, and they are very different in terms of doses. They're typically much higher than those used for anxiety and depression, and the durations are shorter. That being said, the ketamine coma that Maya was in is not a readily accepted practice for the treatment of CRPS. And just so you know, CRPS typically involves beginning with non-steroidal anti-inflammatories, some antidepressants like tricyclic antidepressants, because they have effects on nerve transmission. There's a role for bisphosphonates if there's bone demineralization. In some cases, ketamine infusions are used, but they are technically off-label. Sympathetic nerve blocks are often used depending on where the CRPS is affecting. Usually it's the arms or the legs, and blocks are done either the stellate ganglion or somewhere in the lumbar, in the plexus. Wow, I just struck a blank. Lumbar plexus? Oh my God. I don't perform these blocks. To be clear, they are rather risky. But the sympathetic nerve blocks are often performed to reduce the sympathetic drive to the affected parts. CRPS can affect the trunk. I've had patients who come in for ketamine for truncal areas that are affected. We do have, certainly ketamine can be effective for this, but the ketamine coma with the breathing tube and the ventilator is certainly a tricky proposition. That was what seemingly concerned the doctors that Maya was working with in the hospital for that flare-up. CRPS can be miserable, and that's why my heart goes out to anyone struggling with CRPS, but gaslighting on top of CRPS makes that so much more challenging. And we owe it to our patients as doctors to encourage them to be present with themselves, to be able to hear their gut instincts, to be able to advocate for themselves better, and to minimize the risks of those fears, uncertainties, and doubts from further winding up our central nervous system and ultimately hurting our physical and mental health and hurting the health of our loved ones. Remember, Maya did not commit suicide. It was Beata at the hands of what seemingly happened by the system, though it's still an ongoing trial. We're going to transition to your question and answers now. I just want to remind you that if you appreciate me coming on here after a long day in the operating room, you hitting the like button, sharing what you've learned with others, helps me do this for you more often. Also, you can consider joining our exclusive access where we have private Zoom sessions where we hang out together and I answer your personal questions in much smaller settings. Linda Dove is saying that functional neurologic disorder is ignored. Very related to what Maya was being gaslit with in some ways, especially when she was soiling herself. There are several tests that doctors do to try to prove or disprove conversion disorder. That's a kind of a unfortunate way that is unethical, but yet some people still practice to see, can the person really get up and walk? Because if they're in so much pain they can't walk, well, we'll find out because they're not going to soil themselves. Well, sounds good maybe in theory, but when someone does soil themselves, you lose obviously your dignity, and it's not a compassionate way to try to prove or disprove a conversion disorder. Terry Boyd, thank you for that super thanks. Should you tell your doctor you don't trust him? Terry, I have quite a few videos on how to speak with doctors when that is a concern. I find it powerful in many cases to not necessarily tell a doctor that you don't trust them, but to express concern for a lack of understanding of the plan. So instead of, doctor, I don't trust you, doctor, I'm confused about the plan. Up until now, it hasn't helped me, and it's actually hurt me in a couple of ways. Can you please clarify what you expect from our plan today? Whether it's for migraines, it's for depression, for pain, for gastrointestinal conditions, IBS, for example, you name it. The plan is the foundation of any patient-physician interaction, and you have the right to question your doctor about their plan. Might be more productive than trying to say you don't trust them up front, but very good question. Next question, Lindsay Walker. I have medical PTSD and severe medical trauma as a result of the gaslighting in regards to my CRPS. Well, Lindsay Walker, I'm so sorry that you have experienced that. And this is why no matter what happens from Maya's trial, there are so many of you out there who aren't making news headlines who similarly can find healing through this type of advocacy, I hope. So thank you for sharing your story. What is leaky gut syndrome, asks Palomina. Well, leaky gut isn't what we're talking about today, but in brief, in your intestines, you have a barrier between the food that has bacteria in it and the walls that keep that food inside your intestines and not let it leak into the rest of your body. When there is ongoing inflammation in the intestines, we typically have a concern for bacteria going from the inside of the intestines to the outside of the intestines through leaky cell membranes induced by the inflammation. When that bacteria goes outside of the intestines, it can lead to all sorts of other problems, including systemic inflammation. Valid chronic pain patients have to beg for relief and made to feel crazy, says ITCIS. Well, I have also many videos on this exactly, why the medical system has become, why the pendulum has swung so far, causing patients to feel gaslit with an inability to get opioids when they are possibly helpful. Many risks to opioids, but you have to look at the balance, but the medical system forces doctors into very unfortunate, tight corners where we can't do sometimes what we feel is right for the patient. I'm so sorry that you've experienced that. But I hope that you can also help advocate for others who have experienced perhaps gaslighting from doctors, not being able to prescribe pain medications. Catherine Quintero, do we wake up in operating room or recovery room? It depends on your anesthesia and your surgery, and really the patient themselves. Depends on many factors. Good question. Can a vegan diet fix medical problems, Salamina? To an extent, maybe, but not vegan so much as a whole food plant-based diet, and maybe more generally a diet that excludes processed, refined garbage foods. That itself can work wonders to reduce inflammation throughout the body, and that inflammation also reaches your brain. The blood-brain barrier cannot exclude inflammation from the rest of the body, meaning that when you're inflamed in your body, it typically affects your brain, meaning your mood and your cognition, your memory, kind of your intelligence in some ways as well. Good question. Propofol no longer works on me, says Jean Ward. I'm a freak of nature and not some crazy drug addict. Jean, I'm kind of confused by that. I have never seen a patient who cannot fall asleep with propofol. I'm very curious what doses you're referring to, Jean. I would really love to learn more. Pinhawk says, I am gaslighted by residents in my hospital due to being on narcotics. Pinhawk, very common. There's a tendency to doubt patients who come in using high doses of medications, especially opioids or stimulants or even illicit drugs. It does make it very difficult to treat these patients, but it does not justify, it absolutely does not justify gaslighting. It makes it a very complicated relationship, which is why I always ask patients to please be honest about your illicit drug use with your doctors so that they can at least try to get to the core of what is ailing you faster. Thank you for the kind super thanks, Noda Norsky. I've recently been diagnosed with adhesive arachnoiditis. I can't walk, it is depressing. That is a very challenging condition. I'm so sorry that you've been struggling with that. Did you ever have an infection, I wonder? Did you have any surgery anywhere along your spine? Meningitis? I'm kind of curious where this came out of. But I'm certainly wishing you the best, and I hope others recognize just how challenging that condition can be and are wishing you the best in your healing. Linda says, I saw my doctor assist for pain management, and they made me feel like I was drug seeking, even though I only take it for surgery. And Linda, this is, gosh, I'm so sorry that you experienced that. This is not uncommon because if you only have this much information about a patient who whose personal life and their health history expands way beyond the confines of this room, we follow heuristics or cognitive shortcuts. And often, if we see that one red flag, it does bias our brain into thinking that they're more likely, that the patient's more likely to have other complaints as well. I'm not saying it's right. I'm saying it's a cause, or it's a symptom of a system that doesn't allow for patients and doctors to be able to speak together so that we can expand our understanding of a patient from being one little square to something that actually is holistic. It's what I do in my clinic. That's why I call it holistic ketamine therapy or integrative medicine, because we're trying to bring together, integrate all aspects of medicine that address all aspects of the patient. Let's answer a couple more questions. Al Werco, how do you heal the after effects of prolonged dislocated jaws associated with CRPS or RSD from wisdom tooth removal? CRPS in the trunk is more challenging to treat than CRPS in the extremities. CRPS of the jaw is also challenging. It does depend on where exactly you're feeling that pain, and there is a question in the literature of, do nerve blocks allow for resetting of the nerve transmission? It's an open-ended topic, Al. I don't know the right answer without knowing more about the specifics of what has been done, what has or has not been helpful in the past. But 12 years of unrelenting CRPS in the jaw certainly would warrant moving up the ladder just from, not just NSAIDs and gabapentin, but going into nerve blocks or something more interventional, maybe something like ketamine. Of course, this depends on your discussion with your doctor. White Shirt says, the big surgery is the 25th. Just got diagnosed with rheumatoid arthritis. Don't see that doctor until June. What should I tell my anesthesia doctor before surgery? Well, rheumatoid arthritis has many interactions with anesthesia. The most important for the average patient is going to be how much the rheumatoid arthritis affects your neck. Because depending on how affected your neck is, it influences how much you can move your head back and forth, and that influences how we can place the breathing tube back behind your tongue. There are also concerns, though, about the inflammation with rheumatoid arthritis making heart disease worse, and your heart health is very important in anesthesia when you're having surgery. So there's many things that your anesthesiologist will assess to make sure that your surgery goes well on the 25th. I'm wishing you the best, and I hope others here also send you positive vibes. Why are young women more likely to get gaslit than young men? Teresa, that's a very good question. It's not just young women, but it's also immigrants, those that don't speak English, people of color, etc. I'm not going to pretend like I know the answer, Teresa. It likely stems from power dynamics. You can imagine someone who doesn't speak English. It could be easier to say that their pain is psychologically induced versus someone who does speak the language of the doctor, English in our case, but you can imagine any part of the world being that respective language. In society that men and women have had power plays for millennia, so I don't have to explain how that's a natural cause of concern as well. I have a neck fusion, says White Shirt. Well, yeah, so the rheumatoid arthritis there compounded by neck fusion, White Shirt, your anesthesiologist will absolutely assess. Very good question. Zedding, you're going to a neurologist in KC or St. Louis. I'm wishing you the best for what you're hoping to heal from. I want to emphasize that ketamine therapy needs to be done in the setting of a doctor who is assessing the patient holistically. There are many bad actors out there using ketamine in ways that insurance does not cover, that ultimately exploit vulnerable patients. And I have a video specifically on what to look out for to help avoid scammy ketamine clinics, because they do exist. And I would never want any patients or any viewers to fall into such a clinic. They exist, and I have many patients that come from those clinics to me, and they're just flabbergasted at how different a holistic, compassionate approach is. Not just by me, but anywhere you can find a doctor that is compassionate, understands the ethical and responsible use of ketamine. Can I fly to England? No, Jody, I wish I could. Not right now, but very kind of you to mention that. Let's end with Nora Free's question. How to deal with gaslighting that doctors like psychiatrists, knowing there is not much choice, they are few where I'm from. Nora Free, this is a really, really tough question. If you live in a part of the world where there's only 2 specialists for your mental health, your heart, your liver, your kidney, whatever, and one of those 2 specialists, or maybe there's only 1 specialist, and they gaslight you, what strategies do you have available? It's a tough one. Well, if you were in a big city that had multiple specialists, you could easily walk away, and sometimes that is the right choice. You need to make the decision of how do you bring advocates in to the case when you can't just walk away. Advocates can be family members, can be nurses, maybe it can be a phone call with your primary care doctor. So for example, what I do for patients that are struggling with their specialist, I will get on the phone and speak to the specialist. It might be easy to gaslight one vulnerable patient. It's harder to gaslight a vulnerable patient and their loved ones or family members and their other doctors all at the same time. It's not impossible, but it's much less likely. And if you don't have any other options, please bring support in with you to your appointments physically. Try to be eye to eye. Don't let someone tower over you. If they've given you a gown, ask to change back into your civilian street clothes or whatever you came in with. So it's minimizing the power differential that fuels medical gaslighting. I'm wishing you the best, Nora Free. I hope that everyone here learned something new. If you could hit that like button and share what you learned with others, it would help me do this for you more often. Do please check out the Supercast. And I hope to see some of you in our next private live Zoom in a couple of days. And as always, remember that you have more power over your health than you've ever been told. Until next time.